Look forward to immunisations for tamariki starting on 17th of November. Kia koe, tarako. Minister, back to you, Minister.
Kia ora, thank you. All right, we'll open up for questions now. We're going to start over here.
Why aren't tamariki Māori being prioritised in this rollout?
We are fortunate that we will have enough supply of the vaccine when it arrives to be able to start everybody all at the same time. What I indicated before, though, I think learning from our experience with the adult rollout, I think we need to make sure that we're devoting specific dedicated resource to reaching into those harder to reach communities, particularly some of our more remote communities, and many Māori live in those more remote communities, earlier on in the piece rather than later on. So we know that we can make these vaccines available widely right from the beginning. We won't have to ration, if you like, as we did with the adult rollout. And that means that where we focus our additional resource, so that surge resource, we can make sure that we're reaching into those communities that we know we need to do better. And that does mean that we'll be able to do that earlier on, like right from the beginning. And I think that will allow us to reach Māori earlier.
A good portion of tamariki Māori are at schools decile 1 to decile 4. Why isn't the vaccine program going to be rolled out into these schools?
We will be working alongside schools. What we're not saying is that we're going to do it in every school, because in some schools that wouldn't make any sense. If you're in a highly urban area where there's vaccination clinics everywhere and it's not hard to get vaccine, setting up additional vaccine clinics isn't necessarily the best use of that additional resource. On the other hand, in some of our smaller communities, so if you think about Northland, for example, it's a great example, sometimes the schools will be the centre of that community, and that is a good opportunity to vaccinate not just the tamariki, but also to provide the opportunity for their whānau to come in and be vaccinated. And we can also make sure that we're providing through that people who are informed and who can talk people through what the vaccine is and what it does and how it works, because we know that that's where some of the hesitancy in parts of the country have come from. So I think this really is a good opportunity now for us to not just reach the tamariki, but also reach into some of the adults who may not have been vaccinated yet either.
This tribunal report has found that the government and the vaccination rollout has actually breached Te Tiriti o Waitangi. What's your response to that?
Look, I wanted to take the opportunity to study that report closely, and I obviously have not had the opportunity to do that yet. I have been meeting, Minister Henare and I have been meeting with the Māori Council in order to try and remedy the issues that were being raised even before the tribunal report came out. We know that we don't have the vaccination rate amongst Māori that we want to have. We have an opportunity with the rollout of our 5 to 11-year-old vaccines to do things a little bit differently, to target those resources into those communities more quickly at the beginning without having to, take away from anybody else. We can do that right at the beginning, and I think we will definitely want to take the opportunity to do that.
It's a highly emotive issue, though. What would you say to parents who are feeling quite nervous?
I think every parent is nervous when it comes to anything to do with the health of their children. I'm a parent. I fully understand that myself. But you've got to look at the science here. This vaccine's been rolled out widely across the globe now to young people. It is safe. I perhaps might hand it to my experts, actually, to talk about that as to what sort of messages that they would want to convey to those parents who are reluctant. But, yeah.
Just in response to some of those things, what we find is when whānau have the opportunity to receive information and discuss information with people that they trust, then the uptake of the vaccine is very high. So our target as Māori paediatricians and other healthcare workers interested in children's health is to make that available to whānau, to fill that void that might have been there before with the correct information, reliable information from people that they trust. With respect to resource allocation, we don't see the need for timed, because there's enough vaccine, it doesn't have to be timed for specific groups, but we do see the need for deployment of allocation of resources, which might be funding for specific communication campaigns, for example. It might be resources going to Māori health providers in iwi to make sure, they may decide for their community that using kura is the best way to implement the vaccine rollout. But that's up to them to decide. But once they have that plan, that resources are available to them to support them to make that happen and be successful.
Henry and then to New South Wales.
Can I follow up on that, sorry? Yeah. Is there money that is being ring-fenced for those resources that was just mentioned, specific ad campaigns and stuff like that for Māori?
Well, there will absolutely be specific advertising campaigns around the paediatric rollout, and that will be targeted at those communities there'll be different messages targeted at different communities, so there will certainly be some advertising targeted at Māori there. And with the work that we've been doing with our Māori health providers in recent months, and we've continued to increase the funding available there, we'll also be providing dedicated resource.
On the end of the MIQ changes, is that you've moved it to the end of Feb? Is that just the Australian opening date and everything else is moving too, or are you bringing them together so that end of Feb is when you're intending to open up to? At
this point, it's all together, but I wouldn't rule out further changes there to that second group if we needed to. Having said that, we don't want to disrupt people's travel plans unless there's a very, very good reason to do that. And the reason that we've chosen that end of February date is because it does mean that we can have the booster campaign well through. We can be well advanced with the rollout of the 5 to 11-year-old vaccines in terms of first doses. So all of these things cumulatively add to extra layers of protection.
Health and transmissibility, is it really that unforeseen that Omicron will get out of MIQ sometime in January anyway?
Look, we'll do everything we can to keep it within MIQ, but obviously with a more highly transmissible variant, the risk continues to increase. The infection prevention and control measures that we have in place in our managed isolation facilities are very robust. Having said that, nothing is 100% effective. And so we do have to be prepared for the fact that it could make it out sooner than that. And then,
reopening thinking, if it's out in January anyway.
Look, I don't want to hold out something to people that may or may not happen, and so I wouldn't want to speculate on that.
On boosting booster uptake, a lot of people, about 100,000 people who are eligible for the booster right now haven't had it. Is there a certain level of uptake that you would not be happy with by the end of February? So obviously you're saying it's somewhere 80%-ish of people will be eligible by then, but probably we will like 70 or 60% have actually taken it up, right?
So if we look at our Delta outbreak in Auckland, every percentage has mattered, every percentage has added, and contributed to our efforts in Auckland there. So I'm not setting a hard and fast target in terms of where we want to be by the end of February. But what I would note is I think we're up to about 95% of eligible New Zealanders now having had a first dose, and about 91% having now had their second dose. So really, I think what you can expect to see is we'll still be focused on the equity challenge around first and second doses, but most of our effort will now move to the booster campaign and to the rollout of the vaccination for children.
Just being clear, with the MIQ, when you do, late Feb or maybe March, depending where things are, it's probably got to get there, right? Omicron at some point is going to get there. Are we in a position where, by midway through next year, everyone in New Zealand will either be boosted or have had Omicron?
Look, I don't know, maybe Dr Town might want to provide a comment on that.
Look at that in Australia as well.
Yeah, we'll get out. I'll hand that one to Dr Town.
Certainly those data from Australia are pretty worrying, aren't they, with that explosive nature of these outbreaks, particularly if there's a super spreader event. But I think the Minister is right. We want to hold this back for as long as we possibly can. We know that Delta outbreak that started in August was triggered just by one incursion. And that's all it does take, of course, but the reality is that the longer we can hold it back, all of these measures that the Minister has described are starting to take effect, and the more people that have had their vaccination schedule, and particularly for our adults, these boosters, the safer we'll be. Nothing is guaranteed, of course, and the emerging data suggests that that third dose really does help against severe disease from Omicron, so that's reassuring.
Yeah.
To the families and the people that are stuck in places like Australia trying to get back to New Zealand and have pinned all their hopes on that, January 16th, booked flights and everything were ready to go, and now that's all been crushed.
Look, we've been working really hard to provide as much certainty to people who need to travel and who want to come home as we possibly can, and I'm sorry that we haven't been able to meet that particular deadline or that particular target that we were aiming for. One of the realities, though, is that COVID-19 continues to throw up new challenges for us. And that means that while we can work to provide certainty, we can't always absolutely give people certainty. That's not just something that's happening in New Zealand, it is happening around the world. Many of those countries that had really enjoyed opening up again are now finding that they're having to reimpose restrictions. And so, I think the whole globe continues to be challenged by COVID-19. But I want to acknowledge that at a personal and an individual level, whether it's people whose businesses are affected, whether it's people whose travel plans have been affected, people who are separated from their families, the cost, the personal cost of the global pandemic has been very high for some people.
plan for when the first case of Omicron, gets into the community?
As we've indicated here, our primary focus, our first focus, is to try and delay that for as long as we possibly can so that we can get our protection rates up further through the booster vaccination campaign. We've also indicated, though, that through the traffic light framework, we would be looking to use the red setting as our first response. And then, as always, we continue to adapt and respond as we learn more. And we will know more. The international knowledge base around Omicron is still relatively new, and it continues to grow by the day. So every day that we don't have it here in New Zealand is a day that we can be better prepared and that we can have better knowledge.
Any special considerations being given to sports teams that are returning home sort of late Jan, early February?
We will have to go through our MIQ forward bookings, our group allocations and so on, and look at where the pressure points are. One of the things, you can imagine in doing this, things are moving at speed. One of the things that I will do in the next sort of 24 hours or so is work with MIQ around when we release the next wave of vouchers, because I think it's important that we do that at a time that maximises people's opportunity to take those up, if they're in Australia, for example. And it will take a little while for the airlines to figure what they're doing around flights. So I'll be working with MIQ to make sure that we're not releasing unnecessarily a whole lot of vouchers in the meantime that those people in Australia don't even get the opportunity to take up. So we'll work our way through that. Look, I wouldn't rule it out, but I'm also not ruling it in at this point either.
One more.
One more.
And a lot of the news yesterday about Rory Nairn's death, likely from the vaccine. Do you have a message for his family, and what do you say about the risk of myocarditis?
Look, I'll hand to the technical experts to talk about the risk of myocarditis. But my overall message to all New Zealanders is that the vaccine is a very safe vaccine, and that any small risk associated with the vaccine is by far outweighed by the risk of getting COVID-19. And so vaccination is still absolutely the best course of action. But Dr. Town.
Thank you, Minister. Yes, we were obviously deeply saddened with that report. We do have the benefit, of course, of the Independent Safety Monitoring Board, which has met, and I sit in on those meetings, which is helpful to understand their evaluation. So what they determined was exactly as the Minister has said. Although this particular case was probably associated with the vaccination, it is extremely rare internationally. And the risks of getting COVID, which itself can cause myocarditis, as the Minister has said, certainly outweigh that. The boosters themselves, it's very early days, but we're obviously alert and monitoring safety signals. We think it's unlikely that the booster dose would trigger myocarditis, which, as you know, is more common, in fact, after the first dose, as in this sad case.
Mark.
Do you have a sense, how confident are you that the red light setting will be enough to control Omicron? It's kind of like putting all of our eggs in the vaccination basket, and we know that, even 2 doses of Pfizer, even without waning, only 35% effective against infection.
One of the things that we'll know more about as the coming weeks go by is what the big spike in case numbers that we're seeing around the world does in terms of hospitalisation, in terms of severity of illness, and information there is still quite early, and so we indicated when we went to the traffic light system that we will sort of move away from the daily case numbers being the main measure to looking at things like severity of illness, the number of people in hospital, the number of people in ICU, and so on. Now, Omicron has changed the dynamic there a little bit in the sense that we know that people who have been fully vaccinated, i.e. have had the 2 doses of the vaccine, can also be getting it. And we've seen examples around the world of people who've been, had those 2 doses getting it and still getting sick from it. And so that's why the boosters become all the more important. But we'll know more in coming weeks. But the main message in the meantime is that the boosters really matter.
Would you be open to layering more public health measures on top of it, returning to that sort of Swiss cheese approach, like people like Michael Baker have called for?
Well, I think if you look at the Swiss cheese model that we've got now, we do have a variety of different protections. So we've got masks, we've got, at the traffic light, within the traffic light setting, there's places that you can only go if you've been fully vaccinated. There are a variety of different layers of protection, and of course you can continue to add more layers of protection. What we don't necessarily want to do, unless we absolutely have to, and I'm not saying that at this point we're envisaging doing this, we don't want to have to go back to the alert level system. It is there, as we said when we set out the traffic light framework. It's still there, it's still available for us to use, but we would only do that if we absolutely had to.
Minister, do you think now that MIQ needs to be expanded, or you need to look at it as more of a permanent thing, given we've got another extension for the use of it?
We're still intending, of course, to have home isolation as the default setting for people coming into the country. Now, that's been delayed by about 6 weeks, from the middle of January to the end of February, but that is still what we're planning towards. Managed isolation, MIQ, for the travel across the border of the scale that we, ultimately need to get back to, would be incredibly huge. It would be big, really big. I think what we have been working towards, and we've been working towards this for some time now, is that overall kind of contingency planning for the future. So what sort of capability around managed isolation and quarantine do we need to have, not necessarily just for this pandemic, but for future pandemics? And so we're working our way through that. So yes, there'll be further changes there, I think, is the ultimate answer.
And what advice did the Cabinet get about the wider effects of a delay in opening the border, in particular well-being effects on mental health and also the economic effects on the economy?
Difficult to model the well-being effects, but we do acknowledge that there are well-being effects, that for families who are separated, for people who find themselves in a place where they didn't expect to be for a prolonged period of time, the mental health and the well-being effects can be quite significant. And so we do very much consider that, but we also weigh that up against the potential effect of a large-scale outbreak, and the potential well-being effect that could have on an even greater number of people as well. So there are no easy choices here. In terms of the economic effect, we do know that there is an economic cost to restrictions at the border, but again, the cost of that, at least in the short term, is less than the cost of, say, a level 3 or a level 4 lockdown. And so the more we can do to avoid that, the better for New Zealand.
Yeah, so just on childhood vaccination before the school year starts, what sort of modelling are you seeing about primary schools being used as a vector for the disease, and also do you have like a minimum amount of kids that you want vaccinated, and if you don't reach that, would you look at potentially delaying the start of the school year?
Look, I want to be absolutely clear about one thing, which you'll note I put in the statement. We will not be making it mandatory for young people to be vaccinated. This will ultimately be a choice for their parents. It's a choice that I strongly encourage parents to take. It protects their children. It protects the family, it protects the more vulnerable in their family, including grandparents, for example, or those who may have underlying health conditions. So strongly encourage families to do that. We're not setting a target for the childhood vaccination. We just want to vaccinate as many as we can. There's a lot of water to flow under the bridge over the next month before we started to think about any changes to school opening dates. I'm not contemplating those at the moment, though.
Why not make it mandatory?
Look, we would not make it mandatory for children to be vaccinated. We haven't made it mandatory for the majority of New Zealanders to be vaccinated either, to be clear. It is those where there's a risk profile and a public health justification for doing that. Yeah, there you go. Over in the far corner, and then I'll come back to you again.
What options are on the table for people who have booked flights to come home from Australia from the 16th, who are now sort of in limbo? What options do you have for them in terms of repatriation?
Like I said, we'll be working closely with the airlines to make sure that we can align release of MIQ vouchers with flight availability. So one of the challenges, if we released a whole lot of MIQ space at the moment, and there will be pressure on MIQ given the increase back to 10 days for isolation there, but we will still have some availability. When we release that, we want to make sure that those people who are in Australia can get access to that. And of course, the emergency allocation criteria continues to be in place. So for those who have a critical need to get back, they can still apply for emergency allocations.
Do you have any idea of the number of rooms that you would be able to allocate to people coming home? Capacity is left in the system.
Well, I can tell you that in the most recent lobby release, there were 500 rooms that didn't get taken at all. So the demand has just absolutely disappeared since we made the announcement. And I expect that some of that, some people will be in a position where they will just delay their plans. So, but there will be others who there will be more pressure on. So they'll be looking to either secure a voucher or an emergency allocation. And so we'll be working with the MIQ team to release those vouchers at a time when people have a chance to be able to get them if they're travelling from Australia.
You made the point that we still don't really have much firm data or information on Omicron and how severe an outbreak could be. How dynamic is your risk assessment of it, and how flexible are you to changing to more strict measures or less strict measures as the data becomes available?
I think with all things COVID, I've never ruled things in or things out, because we do have to be adaptable and flexible. Things change all of the time when we're dealing with COVID-19. Sorry, I said I'd come back to you.
So how concerned are you, though, about the risk of Omicron or Delta spreading throughout a school? Like, how much of a risk does a school setting pose for that?
I might ask our experts to comment on that.
We are concerned about outbreaks in schools. We know that transmission does occur between children and from children, probably less than in adults. But we're certainly, one of the factors considered in the decision for paediatric vaccine to be made available to children was the possibility of outbreaks in schools and the virus basically circulating around schools and being a hub within communities. So definitely a consideration in the decision.
And can I just ask you quickly about the border as well, because people are really disappointed that, that it's another delay. Should people be expecting every time there's a new variant that there's going to be a delay in the border reopening?
No, not necessarily. Now,
what, if any, changes will be made to the countries designated as very high risk, considering Omicron is everywhere now?
Yeah, most of those countries that were designated as all those countries that were designated as very high risk off the back of the Omicron variant have now been reclassified as high risk. There isn't a justification any longer to treat them differently, given the rapid spread around the rest of the world.
Centres have Omicron in them with MIQ. Is there in Auckland, Wellington and Christchurch now, or how widely spread is it across the country?
I think from memory, at least I can think of 4. So it's pretty much across the MIQ network.
And in terms of the boosted, at the moment, double jab to get into a lot of places. Can you see a point where we will have to be triple jabbed to get into places?
Quite possibly, and with the vaccine certificate framework, when we release your vaccine passes, they've got a 6-month expiry on them, so that we have that opportunity to make those sorts of decisions.
Minister, will you look to bring 5 to 11-year-olds into the vaccine pass framework?
No.
And secondly, once in theory we get over 90% triple dosed, does that give us enough protection to be able to remove these border controls?
Look, it's still all, there's still so much that's unknown, but we're still aiming towards that end of February target to be able to have self-isolation in the first instance. We want to get to the point where we can have free movement across the border again. I don't know when that will be. It's likely that it's going to be a staged approach, and home isolation is likely to be the first sort of significant step in that.
The Waitangi Tribunal report also spoke about Cabinet's refusal to take on official advice. Why is it that the government continues to refuse to take on advice from Māori health providers or the likes of Te Rōpū Whakakaupapa Mate Uruta?
As I've indicated to you before, we get quite a significant range of advice. We made the decision around the initial vaccination rollout, given the limited supply, to roll out the vaccination initially to those who were most at risk of getting it in the first place, so those who are working at the border, those who are working in our frontline health roles, and to our older population, on the basis that we know, from international experience, that is where it does the most damage. And also then to those with comorbidities, so those who have underlying health conditions. So we made that sequencing decision in the context of limited supply. Now, I think we're fortunate in the next phase of our rollout, where with boosters and also with the 5 to 11-year-old vaccines, that we won't have to ration in that way. And so we can, I think, take a different approach now, which is, and it does mean that we can put equity front and centre right at the very beginning.
For Dr Delore, you're embarking on the vaccination rollout for tamariki Māori. How confident are you that the advice and the guidance that you're going to be giving the government will be taken on board?
I think the early indicators are good, because the findings of the Waitangi Tribunal, I think they are a template for us to identify the problems or areas that were deficient in previous rollouts of vaccination. A lot of Māori organisations, a lot of Māori healthcare professionals who presented at the hearing for the Waitangi Tribunal, we're going to be using those findings to hold the government to account, to form a vision for how this vaccination rollout for 5 to 11-year-olds can be much more successful.
Just finally, we've been speaking to some hospitality workers who are really up against it. They're feeling the pressure. They're getting tired of the aggression, of the abuse when asked for people to provide their vaccine passes. What advice do you give to these businesses?
It's not so much advice to the businesses as a request of all New Zealanders. We're heading into Christmas. Relax, be kind, be understanding of people who are doing their jobs. They're not doing this because they want to. They're doing this because they're required to. And so, just to everybody else, cut our hospo workers a bit of slack. They're doing their jobs. It's a tough job. It's been a really tough couple of years for them. And so embrace the festive season and show some kindness.
In regards to the Waitangi Tribunal report, we've already gone over it in terms of why you decided to go against the advice you were given, but do you regret that decision?
As with all things COVID-19, there are always things that you look back on and think, I wish I had better choices when we made those decisions. Now, we made those decisions in the context of a very limited vaccination supply early on. We don't have that now, and so we're able to make different choices. And I'm absolutely confident in the choices that we're making around, this next vaccine rollout, that some of those equity issues that we encountered in the first part of our vaccine rollout, we can avoid them this time around.
Is the government racist?
No, I don't think so.
A question for Dr. Tan. The Gauteng in South Africa, sort of the epicenter of their Omicron wave, seems to have turned the corner. The cases are flattening and falling now. What do you make of that? Is it possible that Omicron sort of spreads like wildfire and then sort of fades just as quickly?
That's a really interesting question, isn't it? Probably one more for the new year. I think the situation in South Africa is really quite different to what we're seeing in Europe, particularly the UK at the moment, and in Australia. There, of course, the number of people who've experienced COVID is very high, so they have natural immunity as well, and the vaccination will have topped that up. So I think that dynamic is very much in a previously infected population, and yes, the initial wave seems to be flattening, but I think more worrying for us is what's happening in Europe, in Australia, and places where people come to New Zealand from, because that'll be the risk that presents at our borders.
All right, we might wrap up shortly, but Janae, I haven't had a question from you. I think you arrived late, so
yes, I did. I was busy writing the news. The border opening for people, New Zealanders, anywhere around the world other than in Australia, can you be any more specific when you think they might be able to come in without having to go into MIQ?
So like I said, we're now aiming towards that end of February date for home isolation to be the default for those coming into the country who are New Zealand citizens who have a place where they can home isolate.
So that's for people coming from Australia and other parts?
Yes.
Change the MIQ for 7 to 10 days. When is that going into effect? The people in MIQ now got to have their stays? It'll
be those who, it's prospective, so it'll be those who are arriving after the date in which that new requirement comes into effect. So we've got to go through the process of changing the audit. So it'll be, that will come into effect in the next couple of days, and it will be for those arriving after then changes come into effect.
Here now to have a longer stay or anything.
But what if
that's right?
But what if you've got Omicron in the MIQ facility?
Then they're subject to a different set of rules. So for those who are close contacts of a confirmed case, then they stay for the full 10 days.
Think a little bit more about your willingness and Cabinet's willingness to use more strict measures. It seems like your overall message is basically, we don't want to do lockdown at all over the summer. Even if Omicron gets out, we'll use red instead, unless some drastic news about how bad Omicron is. But on the current data, would you lock down if you got a message from Ashley Linfield tomorrow saying we found 2 cases of Omicron in the community?
No, I think the red traffic light framework is our go-to, at least initially, and we'll see how things unfold from there.
Question for Dr. Delore. Has there been any advice given to the government to prioritise vaccinations for tamariki that was rejected? Did you give any advice to the government to essentially work even harder to get to tamariki before the rest of the population, to prioritise them?
From my perspective as a Māori paediatrician, there's only a small group of us. We have given advice through the COVID Technical Advisory Group, and it wasn't that specific, but it certainly in our wording is to prioritise vaccination for tamariki Māori 5 to 11, and how that happens, as I said before, is not so much the timing of it, because there is plenty of vaccine available, but it's where the resources go to.
And do you think the government is complying with that?
Well, as I said there, I think the indications from the government are that they are listening, that they're taking on board those lessons from previous vaccination rollouts, and so I'm positive, and I'm encouraged by what I've heard from the government so far. I would point out that there are a lot of other Māori organisations who are working with the government now about what role they will play in the paediatric rollout of vaccination. And I can't speak for those groups, but I'm sure that we will be hearing from those people in time. And as the weeks go by towards the start of this vaccination program, we'll find out more about what the government's commitment is to me.
Just finally, in your opinion, do you think the government's response now is still complying with the treaty principles, or is breaching?
That's a hard question. I would like time to go through the findings of the Waitangi Tribunal. I think there won't be a point where we say we're completely happy with the vaccine rollout for Māori. We're going to keep pushing. We're going to be looking for new ways to do things, new ways to achieve those equitable outcomes, particularly for tamariki Māori.
All right, thanks very much, everybody.
Apologies everyone, I see we're a bit tardy this afternoon. Well, kia ora koutou katoa and good afternoon. Today, Cabinet undertook its first review of the new COVID-19 protection framework, which came into effect roughly 10 days ago. Cabinet considered several factors when deciding whether or not to move regions into different levels in the traffic light system, including vaccination rates, health system capacity, and the status of the current outbreak. It is encouraging to see Auckland's case numbers have continued to decline since the new framework came into effect, giving cause for cautious optimism. The 7-day average number of cases in Auckland as of Friday was 113 a day, compared to 126 the week prior and 179 the week prior to that, all lower than the 200 cases a day that modelling suggested in early November. This lower number of cases in Auckland is good news for all of us, as it reduces the risk of the virus spreading outside Auckland once the boundary changes on Wednesday. We currently have 61 people in hospital, 4 of those in ICU or the high dependency unit. Case numbers, new hospitalisations and new cases in ICU are all running slightly under the levels predicted. The R rate, which is indicative of the pace of spread, slowed to under 1 for the first time in several months on the 1st of December. Over the past 2 weeks, our vaccination rates in total have increased more than the previous 2 weeks, and as a country, we are now just 47,527 vaccinations away from hitting 90% fully vaccinated. So as I said last week, we should hit that milestone in the middle of this week. But there are other factors we must also keep in mind. Firstly, that we have long said we want to see good vaccination levels across all parts of the country. Those areas outside of Auckland that are in red, for the most part, won't reach rates in the mid to high 80s till the end of December. Secondly, while Auckland is one of the most highly vaccinated regions, it continues to be the centre of the outbreak, with several hundred active cases obviously being managed. And while there is good cause for optimism, we only moved into the new COVID protection framework just 10 days ago, which doesn't yet represent a full transmission cycle. However, ministers and the Director-General were supportive of recognising the progress that has been made and will be made in the coming weeks as people seek their second dose. They also expressed a view that with an additional transmission cycle, they believe there will be enough comfort for Auckland to move. On this basis, Cabinet has decided on the recommendation of the Director-General to move Auckland to orange at 11:59 p.m. on Thursday, the 30th of December. Cabinet has also decided that those remaining areas that are currently in red, excluding Northland, will also move to orange at 11:59 p.m. on Thursday, the 30th of December. This decision means that Auckland will move approximately 4 weeks after they moved into the COVID protection framework at the beginning of the month, and will give extra time for any potential impacts of that move to be seen. This represents 2 incubation periods of the virus, which we have consistently used to provide confidence around outbreak control throughout the pandemic. It means we can see the impacts of also the Auckland boundary opening. It means that other regions at red, currently Taupo, Rotorua Lakes District, Kawerau, Whakatane, Opotiki districts, Gisborne District, Wairoa District, Rangitikei, Whanganui and Ruapehu districts, have an additional period of time for second doses to be administered